Hi. Hello, everyone. Welcome to today's Pet Pawcast. I'm your host, Dr. Roberta Westbrook, and this is my co-host here, Frosty. Thank you so much for joining us today for our show. We have a really interesting show for you today. We are going to talk about elective procedures, and I'll tell you in a few minutes about what elective procedures are, and Frosty's going to help me. So thank you, Frosty, for being here. So thank you again for coming on down. Frosty is available for adoption. He's about a 5-year-old neutered male cat. And see all of the dogs and cats and puppies and kittens that we have available for adoption. So one of the things I wanted to talk about in terms of elective procedures are those surgical procedures that we perform on pets, that veterinary surgeons will perform on pets, and they're optional surgical procedures. They are not required to do in terms of making the pet live a longer, happier life. They're not required, but many of them are recommended by veterinarians. And then some of them are somewhat controversial. Frosty can take a little break there. So we're going to talk about some of those elective procedures. And when I talk about elective procedures, again, I'm talking about some optional procedures. I'm talking about some that are controversial that we may not want to do, but some of these elective procedures are actually recommended and they actually can help your pet. So let's start with again, the definition of elective procedures and some examples. When I'm talking about elective procedures, I'm talking about things that in the controversial category would be procedures like declawing in cats, or I would be talking about tail docking in dogs or ear cropping in dogs. These are some controversial elective procedures. An elective means it's a choice. It's not something that is required. It is a choice, usually by the owner of the pet. So those are some elective procedures. There are also elective procedures that we recommend, that veterinarians recommend, because we actually believe that these procedures, and there's research to show that these procedures will help your pet. Those elective procedures that are recommended are things like spaying and neutering. So spaying and neutering are considered elective because they're not required in order to save your pet's life, but they could increase the longevity of your pet's life. They can prevent many health issues. Spaying and neutering prevents some types of cancers. And so these are elective procedures that can actually benefit your pet. So those are kind of the two categories. And so when you hear the term elective procedures, all it means is it's a surgical procedure that is a choice that the pet parent has the option of choosing which procedure they want to have done in their pet, along with the veterinarian's advice. So what questions do you have about some of those procedures that I've mentioned?
So I guess some elective procedures do count as preventative care, like that spay and neuter.
Absolutely. Some elective procedures are preventative. So for example, when we spay a female dog or cat, what we're doing is we are preventing some potentially life-threatening illnesses like infections in the uterus. So an infection in the uterus can be life-threatening. By spaying, even though it's an elective procedure, we're able to prevent that. Another example of an elective procedure that's going to prevent a potential life-threatening condition is a surgical procedure called a gastropexy. A gastropexy. What a gastropexy is it is where in some large breed dogs, those that are prone to have a twisted stomach, a stomach that twists and causes bloat, a gastropexy is a surgical procedure where the surgeon will actually suture the stomach in place inside the abdomen. The surgeon will suture the stomach in place so that it does not twist on itself, causing a gastric dilatation and volvulus or a bloat that could potentially be life-threatening. So yes, those are some procedures that are elective. They are a choice to do, but could prevent some life-threatening conditions in the future.
And the mass skin growth removals can sometimes be considered elective. When does it warrant like urgent attention?
Yes, so sometimes there are mass or growths on your pet skin when your veterinarian evaluates those, often your veterinarian will determine whether or not he or she believes that that mass or the growth needs to be removed right away, or whether it's an elective procedure, just cosmetic. So if your pet, for example, is geriatric, is older, sometimes geriatric pets will get little wart-like growths on their skin. They look like little small skin warts. They're usually benign. They're typically benign little warts, and they're just cosmetic to be removed. And so your veterinarian may say, okay, it's an elective procedure to remove these. It's just purely cosmetic. Now, there are some other growths on the skin that tend to grow really fast or change in color or shape, or they begin to bother your pet. When masses or growths begin to change, begin to affect the pet, they become bothered by it, or they bleed, or they become infected. Usually, in order to get a definitive diagnosis and to allow your pet to be more comfortable, your veterinarian may recommend that that mass be removed.
And the same for dental cleanings. I always thought, dental cleanings was, mandatory to do for our pets, but I guess it's kind of weird to think it's as selective because it's not mandatory.
Yeah, that's right. So even dental cleanings, we recommend them. They're highly recommended, and we know that getting routine dental cleanings are going to improve your pet's quality of life and very likely their longevity of life. We also know that it's not in the moment a life-threatening procedure that has to be done generally. So that's why we call it elective. It still is a choice, but it's very highly recommended. And since you mentioned that, what are non-elective procedures? So you may want to know, okay, well, what are some non-elective procedures? What are some things that must be done? So a non-elective procedure would be a surgical procedure that's performed that needs to happen immediately to save the animal's life, or it needs to happen, in a relatively short period of time in order to allow this pet to live a long, healthy life. So this would be, I mentioned earlier, the disease pyometra, where there's an infection in the uterus. That disease can be life-threatening, and female dogs and cats that get this disease can die. And so performing a surgical procedure to get the infected uterus out would be considered something that's non-elective, meaning, it's not, we don't want that to be a choice. We want that as the treatment for the disease. That's going to be the way that we save that animal's life, by performing that surgical procedure. Another example would be if your pet, I mentioned doing a gastropexy to prevent a gastric dilatation and volvulus, to prevent that bloat. If your pet already has bloat, they already have a twisted stomach, it's an emergent procedure. It can be life-threatening, and so it has to be done right away. This would be an example of a non-elective procedure that needs to happen right away to save your pet's life.
And then, so under the category of elective procedures, there's some that, like you were mentioning, that were more for cosmetic reasons. What are the types, and can you go a little bit more into them?
Sure. So, for example, for many decades, pet owners have elected to perform procedures on their pets, like ear cropping, tail docking, and even declawing their cats. So we're going to bring Frosty back, and I'm going to show you a little bit about declawing. So typically, if you've been ever wondered what it is like to declaw the cat, sometimes people think that declawing a cat just means that we're going to cut the toenails short. But essentially what declawing is it's removing the very distal portion of the cat's toe. I'm going to see if Frosty will allow me to use him as a demonstration here, and I'll show you the portion of his paw and his toe that would be removed. So if you can press on your cat's paw, and you can see that digit where the toenail is, it's that portion, it's that entire portion, the tip, very, very tip of their little toe, that is actually removed in a declaw procedure. So it's just that little tip. So it's a little uncomfortable for me to press on it. And so it is removing a little portion of their digit there. And so over time, it can affect the way that the cats bear weight on their paws. And in some cases, it can cause chronic pain, and other behavior concerns because they're painful and they're bearing weight abnormally on their paws. He's very, very sweet, aren't you? So, oh yes. Oh, look.
And are there any health benefits to declawing?
No, there's no health benefits to declawing. In the past, declawing was done to prevent injury to people from their cats scratching them. It was also done to prevent damage to curtains and to furniture and to shoes. And so one of the ways that people wanted to prevent those things is by just removing that portion of the toe that grows the claw. But it winds up doing more damage to the pet than it does good for the person. So there are certainly other options out there to protect your furniture and to protect yourself. You're sitting so
Yeah, that was a
wonderful.
question, to see what are alternative solutions to kind of declawing.
Yes, declawing. So there are some wonderful products out there. First of all, you can talk to your family veterinarian or maybe a local groomer about how to trim your pet's claws routinely to try to keep them dull and short. You also want to make sure that you get your cat proper scratching posts so that he or she can scratch on scratching posts and use those claws in the appropriate way, which is on a scratching post and not your couch. And then there are also little plastic caps that you can put over the toenails that are called soft paws. It's a little plastic cap that you can put over the cat's toenail, and it has a dull tip. And so it does less damage if they were to scratch something that you didn't want them to scratch. So those are some options rather than performing the declaw procedure, in which this very distal joint of the cat's toe would be removed there.
Another one that's kind of seen as plastic surgery is ear cropping. And there's a myth that it kind of helps with ear infections.
Yeah, so I would agree with you that that's a myth. So, the breeds of dogs that typically get ear infections are those that have really long, floppy ears, like Basset Hounds and Cocker Spaniels and, Shih Tzus and Lhasa Apsos. And those aren't the breeds that typically have cropped ears. So the breeds that typically have cropped ears are typically breeds that don't have those really long, floppy ears. And so, the idea is that keeping the ears erected open allows more airflow through there and prevents some infection. But in a lot of these breeds, they wouldn't get ear infections anyway. It tends to be more of a cosmetic surgical procedure. And then it's also used in pets that were going hunting or that were going to be outdoors. Then cropping the ears was used as a way to prevent injury to the ears. So if they're hunting, they don't want the ears to get attacked by wild boars or other animals. And so it was a way to prevent injury to the ears. But again, we know that the ears are very, very important. Dogs communicate with their ears. The way that they move their ears is very important. And so when we crop the ears, sometimes that can affect the way that they communicate. And it doesn't necessarily prevent ear infections at all. So right now, we consider it a cosmetic procedure that doesn't have a lot of benefit.
And why do you think some veterinarians still kind of perform these type of surgeries?
Some veterinarians may perform these types of surgeries because, unfortunately, we want the surgeries to be done well and done right if they're going to be done. So, it can be a controversial thing, but certainly some people are going to try to perform these procedures, unfortunately, without anesthesia sometimes and in unsanitary environments, non-sterile environments with very little skill. We do not want that to happen. We do not want those types of, controversial, very difficult and painful procedures to be done by unskilled professionals. So there may be some veterinarians out there who offer the service so that it can be done the right way. It does take a lot of skill. It does take a long recovery oftentimes for the pets. But there's some veterinarians who are willing to provide that service so that they can monitor it and make sure that it's done in a humane way for the pet.
So if somebody kind of tries to do, the ear cropping at home when just a few weeks old, can that be considered cruelty case if it's done, not supervised by a veterinarian?
Yes, it's illegal to perform any surgical procedure in your home. So surgery is reserved for licensed veterinarians. And so we certainly do not want anyone performing these surgeries themselves in their garage or in their home at all. So yes, that would be considered animal cruelty for sure. And please report anyone that may be performing such procedures.
And toe docking is sometimes seen with happy tail. Would that be, I guess, preventative care or more of an elective procedure?
So there's a little bit of a word difference there. So when we're referring to tail docking, we're referring to removal of a portion of the tail in usually 2 to 5 day old puppies only.
Okay.
That's what tail docking is. If there is an adult dog that has what we call happy tail, they have the tip of their tail that repeatedly gets injured, becomes infected, or it's bleeding because they wag their tail so much because they're happy, and sometimes it hits the walls, it hits the tables, and it becomes a chronic source of pain and infection, then veterinarians may opt to do a partial tail amputation. So if it's an adult dog, and if it's for a medical reason, then veterinarians may perform a surgical tail amputation. Tail docking is only done on 2 to 5 day old puppies. And tail docking is actually done without any anesthesia. It's done without any anesthesia. And it's done when the puppies are still in development and they don't have completely solid developed bones. And so that's the difference in those two procedures.
I guess that's why it's so crucial to have it done within those few days.
Absolutely.
And we've heard of devocalization, but is that a real thing? Do people actually kind of sometimes perform that surgery?
That used to be something that people had done, and it's hard to know how many veterinarians are out there that still perform that procedure. But again, a very controversial and not recommended procedure. So, devocalization was a procedure in which the owner elected to get this surgical procedure done to prevent their dog from making loud noises when they bark. So it was in an effort to decrease the sound when their dogs bark. So dogs that have been debarked, that may be a more common term that you've heard, that have been debarked, have had a portion of their vocal cords surgically removed so that when they make the barking sound, it's dulled, it often sounds more hoarse, and maybe could be less of a nuisance. But again, not considered a recommended or necessary procedure. And this procedure is very rarely, if ever, done these days.
And are these type of surgeries can be performed by any veterinarians, or like you said, they're becoming more rare, or do they have to be done by a specialist?
These procedures are becoming more rare, so it may be that people are having a hard time finding a veterinarian who is willing to perform these procedures because they just haven't been proven to be beneficial to the pet. And so it can be performed by any licensed veterinarian, but you may have trouble finding a veterinarian who is willing or has the skill to perform some of these procedures, just because they are becoming more rare. In some countries, these procedures are even illegal and banned because they haven't been proven to have any benefit to the pet at all. And so we want to make sure that we're allowing pets to live, happy, healthy lives. So yes, there may be some veterinarians out there who perform them, but it may be harder to find them these days.
And then one last thing, there is a differentiation between declawing and dewclawing surgery, correct?
Oh yes, that's a great question. So when we talk, as you saw Frosty help me demonstrate what we mean when we say declawing a cat means declaw, removal of the claw, of the distal portion of the claw. That is different from dewclaw removal. So DEW, dewclaw removal, is when your when a licensed veterinarian removes essentially the vestigial, it's like a remnant of a digit that occurs on the inside of the paw. Excuse me. It's kind of equivalent to the 5th digit here, to like our thumb. And it's on the inside of the paw. That's the dewclaw. And so some dogs will have dewclaw that is a little bit wiggly and not attached. And in some cases, that dewclaw can get caught on things and cause injury. And so it is an elective procedure to have the dewclaw removed, it's typically done at the same time as a spay or neuter, and it can certainly help to prevent injury later on in life. So that's a dewclaw removal, and then in cats, it's a declaw procedure.
So I guess it's, kind of good to know that whether we're considering any type of surgery, whether it's, that mass removal or even dental cleanings, to, talk to veterinarians and kind of see whether they're a benefit or a risk of these procedures.
Yes, absolutely. Please, contact your family veterinarian. They will give you all of the pros and cons to these procedures and help you determine whether it's in the best interest of your pet or whether it's just a cosmetic, completely optional procedure. So let them guide you and direct you, and let's keep our pets safe, healthy, and happy and live long lives. We thank you again for joining us today on the Pet Pawcast. I'm so happy to speak to you guys every week. Please come on down to our campus for all animals. We're open every day from 11 a.m. to 6 p.m. Our adoption center is open, so bring your family and friends. Come on down. We're so excited to visit with you. Frosty is waiting for his home, so come visit with him as well. We'll be happy to see you next week as well. Okay, bye-bye.